At sea, medical emergencies are never routine. Seamen are uniquely dependent upon their own resources when a crew member or passenger suffers illness or injury. On board a vessel, every crew member must be capable of taking immediate action upon encountering an accident scene or sudden illness.
Oh man, my chest hurts.
What's going on?
Oh, it's hurting down my arm. Really
This program is intended to build your skills and confidence as a first responder who can manage the emergency until help is on the scene. While it's your responsibility to act, remember that you're not alone. Your job is to stabilize the victim's condition until additional personnel arrive. Once a supervisor or the medical officer has assumed command, your job shifts to a supporting role. The dramatizations you're about to observe demonstrate how to perform effective immediate actions in response to simulated emergencies based on real incidents. The demonstrations represent a minimum standard of competence in first aid, and you will require additional training as your onboard responsibilities increase. If you encounter a medical emergency, you've got to get help.
Bridge, engine room.
Call or shout for assistance, but don't leave the scene until you've performed a preliminary examination.
You all right? John! Tom! Craig!
If the victim isn't breathing and doesn't have a heartbeat, or if he's suffering from spurting blood loss, you have to provide immediate care.
Hey, John!
Survey the scene before you rush to assist. Your first job is to protect yourself. You can't help if you become a second casualty. Eliminate physical hazards to yourself and those around you before you approach the victim. You should also protect yourself from communicable diseases. Your vessel's medical kit should include personal protective devices that serve as barriers between you and the victim's bodily fluids. You may also represent a threat to the victim. Take care not to contaminate sterile surfaces as you use first aid supplies. The textbook approach to first aid doesn't always apply to the real world, however. Ready-made medical supplies and equipment may not be immediately available at the scene of an accident, and you may have to improvise or do without. You may have to decide whether the highest priority is rendering immediate assistance or taking time to get the medical kit. The simulations you're about to observe reflect that reality. Sometimes the medical professionals undertaking these demonstrations have determined that fast response outweighs other considerations. You've also got to try and keep your emotions in check. Feeling scared and inadequate is natural, but don't allow yourself to panic. As you respond to the casualty, take care to cause no additional harm. Sometimes the best you can do is to avoid making the emergency worse.
Tom, come on! Looks like Joe fell down the stairs.
Joe, you awake? Joe.
Don't move the victim unless it's absolutely necessary. Unless you have no alternative, wait until help and the backboard arrive before attempting to reposition someone with suspected head, neck, or back injuries.
How's it feel? Is that soothing your burn a little bit? Yeah.
Offer gentle reassurance.
All right, buddy, this is going to be okay. We'll get this taken care of.
No matter how scared you are, try to appear confident and competent.
Okay, Joe, open your eyes.
Identify yourself.
Look at me.
Assure him that you've had first aid training and that more help is on the way.
Does that hurt back there where he's got his hands?
Oh, a little bit.
Okay.
Talk to the victim each time you touch or treat him, but watch what you say. Even if he appears unconscious, he may be able to hear you. Use words that stimulate hope rather than despair.
What happened here? Buddy, wake up. Are you okay?
Ask the victim what happened. If he can't answer, ask witnesses what they saw and study the scene. Understanding the accident will help you assess the injuries. If you have to reposition the victim's body to perform rescue breathing or to move him away from danger, be extremely careful. Use the log roll technique to position him on his back as you stabilize the head, neck, and spine by means of hand traction. We'll talk more about protecting the spine in a few minutes.
And we'll do one scoot on 3. 1, 2, 3.
If the victim's heart and lungs aren't working properly, he may quickly suffer brain damage or death. Next to causing no additional harm, The first responder's first priority is to support breathing and circulation.
5 and 6 and 7 and 8. 9.
The purpose of the procedures known as cardiopulmonary resuscitation, or CPR, is to supply oxygenated blood to the brain. These procedures help keep the brain alive, but won't restart the victim's heart. If he's suffering from cardiac arrest, you've got to have help and the vessel's automated external defibrillator to boost his chances of survival.
Okay, I'm clear. You're clear. You're clear. Everybody's clear. Here we go.
Okay, let's take your clothes off here. Let's loosen up some of these clothing here.
If he is conscious but has difficulty breathing, help him assume the most comfortable position. Loosen tight clothing.
Let's bend you forward just a little bit more. John, would you open the door and just stand back for me, please? Just stand back.
Open doors or hatches to augment the supply of available oxygen. Clear the area so he has room to breathe. Keep him quiet to minimize the demands on his circulatory system. Administer supplemental oxygen if you can. If he's unconscious, check the ABCs. Check to see whether he has an open airway, whether he is breathing, and whether he has a pulse or other signs of circulation, such as coughing or movement.
Buster!
If you can, check for breathing and signs of circulation before you move him. Check the pulse at the neck on the side nearest you. If his airway, breathing, and circulation aren't compromised, leave him where he is until you have help. Remember the ABCs. They always come first. Here's a closer look at how to check and support airway, breathing, and circulation. Determine the victim's responsiveness.
Kevin! Help!
Talk to him. If he answers in a normal voice, his airway and breathing are probably okay. If he's unconscious, you need to provide an airway. Carefully position the victim on his back on a hard surface, and then lift the chin as you gently tilt the head. If he has neck or facial injuries, open the airway using a jaw thrust. This position enables you to stabilize the neck at the same time. Open the mouth and clear away foreign matter like food, gum, or dentures. If necessary, gently roll him on his side to drain blood or vomit away from the airway. When the airway is clear, look, listen, and feel. Look for the rise and fall of the chest. Listen for the sounds of breathing. Feel for a pulse at the neck.
He's not breathing.
Take time to be sure of your findings. His breathing and pulse may be weak and slow.
I don't feel a pulse. We're going to have to do CPR.
You want me to get help, Tom?
Yeah, get help. Get equipment and make a call. Make a call. Check the time for me.
If he isn't breathing, you need to support the flow of oxygen to his brain. Create an open airway by gently tilting the head, lifting the chin, and opening the mouth. Clear away foreign matter or secretions. Begin rescue breathing by pinching his nostrils and forming a tight seal with your mouth. Blow slowly and steadily until you see his chest rise. Give 2 breaths, lasting about 2 seconds each. Recheck for pulse or signs of circulation. If you can't detect heart function, begin performing chest compressions by placing the heels of your hands just below the center of the breastbone.
1, 2, 3, 4, 5, 6,
Lock your elbows and compress the chest firmly and rapidly 15 times.
11,
You may feel cracking, but don't stop.
14,
His ribs will
15.
heal if you keep him alive. Alternate giving 15 compressions and 2 breaths. After 4 cycles of 15 and 2, recheck for breathing and pulse. If you detect a pulse, stop performing chest compressions, but continue to monitor the victim's condition carefully.
He's got a good pulse. I see a good rhythm there on the screen. Let's go ahead and put him on a non-rebreather. Hey, can we get some help over here?
Performing CPR is extremely tiring.
11.
If help is on the way, continue until someone else relieves you or you're too exhausted to go on.
Oh, man, I'm getting tired.
Remember, CPR doesn't restart the heart.
Okay, move your hands away.
only a defibrillator can restart the heart of a victim whose heart is in an arrested state. That means that if no one has come to assist you, and you still can't detect respirations or pulse after 4 cycles of rescue breathing and chest compressions, run for help and the defibrillator. If someone appears to be choking, ask him what's happening.
Terry, you all right?
If he is able to breathe and answer, keep him quiet and call for help. Your objective is to prevent a partial blockage from becoming a total obstruction of his air passage. If he can't speak and his airway is blocked, perform the Heimlich procedure. Place one fist on his abdomen, just below the breastbone, and grasp it with the other hand. Here's the proper position for your hands. Pull sharply inward and upward. Continue the thrusting process until air expelled from the lungs dislodges the foreign object. Watch the procedure again. It's called the Heimlich maneuver.
Kevin, are you choking? Look behind you here. Got it, buddy?
Thanks.
Buster, you okay?
You can perform a modified Heimlich procedure when the victim is on the ground. You can also do it on yourself, on the floor, or over the back of a chair. He'll be scared and tired after the incident. Comfort him and keep him quiet. The inability to breathe during the choking incident may have lowered the normal tissue oxygen content of his body. Give him supplemental oxygen if you can. Keep him at rest until he's fully recovered.
Okay, you start to feel better? Can you breathe?
As you check for injuries, look for obvious signs of serious bleeding and try to determine its source. An adult body contains about 12 pints of blood. Loss of more than 1 pint causes a significant reduction in the number of red blood cells that carry oxygen to the brain and may result in a dangerous drop in blood pressure. A bloody wound often looks worse than it is. Arterial bleeding that represents an immediate threat to the victim's survival is characterized by vigorous spurts and usually won't stop by itself. Before you provide treatment, protect yourself. In a pinch, you can use any clean material as a protective barrier. Use a gauze dressing or clean cloth as a barrier between yourself and the victim's blood. Apply hand pressure directly over the wound or to an artery between the wound and the heart.
Nauseous?
Maintain the pressure, adding additional absorbent materials as necessary.
Hey, James, just isn't doing the job. Why don't you give me a trauma dressing and a bandage, and we'll go right on top of this. Okay?
When you can, replace your hand pressure with a compressive bandage, securing it firmly in place with tape or an elastic wrap. Elevate the wound above the heart to slow the bleeding, unless this causes additional pain or injury. Apply additional bandaging as necessary for absorption. Apply a cold compress to constrict blood vessels near the injury. Your objective is to restrict the blood flow sufficiently that the body's natural clotting process takes over, without cutting off circulation completely. Monitor the area beyond the wound to ensure that the bandage isn't too tight.
Joe, I'm going to check your foot here. I want you to tell me, can you feel that?
Make sure the skin doesn't become cold, numb, or discolored. If the affected area is an arm or leg, check circulation by means of a capillary refill test. Squeeze the tip of a finger or toe until it blanches white, then release the pressure. Normal pink color should return within 1 to 3 seconds. If circulation and color don't return immediately, the wound or the bandage may be inhibiting circulation. Loosen the bandage, taking care not to restart the bleeding, and test again. Treat medical emergencies in a manner that minimizes the potential for shock, a physiological response to trauma characterized by low blood pressure and the threat of circulatory collapse. Keep the victim lying down. Keep him quiet. Keep him warm. If his vital signs are weak and the procedure won't cause further injury, elevate his legs above the level of the heart. We'll talk more about vital signs in a few minutes. Supply oxygen if you can.
Remember what happened? Okay, just stay still. Try not to move. Take it easy.
Attempting to move an injury victim who has a spinal injury could cause substantial additional damage. The spine is the body's central structural support. It houses the spinal cord and pairs of nerves that travel throughout the body. These nerves carry commands to your organs and muscles and relay instantaneous messages relating to touch, temperature, and pain. Be extremely careful to avoid causing additional bone, spinal cord, or nerve damage. Don't move the victim until you have help, unless it's the only way you can provide treatment or protect him from further harm. If he's conscious, ask him if he is experiencing back or neck pain.
Your neck hurts? Okay, stay still. Try not to move. You're going to have to stabilize your neck now, okay?
If he says yes, be extremely cautious about moving him. If he's unconscious, confused, or intoxicated, assume he has a head, neck, or spine injury and be equally cautious. Before you move him, stabilize the cervical spine using hand traction to keep the head in a neutral, midline position. If you have help, one person should be assigned to maintain spinal traction. As soon as possible, apply a cervical collar.
You know what ship you're on, Frank? Can you tell me what ship you're on?
You can improvise a cervical collar out of a pillow or rolled towel. If you have to reposition the victim, roll his body gently as a unit.
Okay, just right over like that.
One person should use hand traction to support the head and neck, while others support the hips and legs. A backboard must be used before transporting the victim. In a pinch, you can use plywood or a door. Slide the backboard under the victim, moving him as gently as possible.
Pretty good position here. 1, 2, 3. And we'll do one scoot on 3. 1, 2, 3. Good. Okay. All right.
Strap and tape him securely to the board before you try to lift him.
1, 2, 3, 4. All right, towards me, gentlemen. Head first. Always go head first. Going into the galley. Bring him around, behind you.
Hey, what's wrong? What's wrong?
If the victim has been burned, it is important to prevent further damage. Here, the injured extremity is immersed in cold water to cool the tissue. You've got to stop the burning process as quickly as possible by cooling the affected area or removing the source of heat. You can use ice to cool the burn, but be careful not to cause further damage.
Don't freeze it. Take it in and out. Okay?
Don't use dry ice or blue gels. They're so cold that they'll cause additional burning.
That will just freeze the hand.
Burns are now classified in terms of 4 levels of severity. Burn injuries can be considered relatively minor if they are superficial or superficial partial thickness burns involving less than 15% of the body area. These burns do not extend all the way through the skin layer, which retains sensitivity to light touch. An older classification system referred to these injuries as first and second degree burns. Cut away gear or clothing to expose a small burn. Remove foreign matter, but leave blisters intact.
Can you feel that? Yes. That? Yes. That?
Gently probe the skin to confirm that the victim still has sensation in the affected area. Application of a burn cream or antibiotic ointment is soothing and helps prevent further infection. Apply a bulky, loose-fitting dressing made from sterile gauze. Monitor the area beyond the wound to make sure the dressing doesn't restrict circulation. Many facial, genital, hand, or foot burns are special cases that may require consultation with a physician to minimize scarring or loss of function. Burns that extend into deeper skin layers or completely through the skin are referred to as deep, partial thickness and full thickness burns. These serious injuries were classified as third-degree burns under the older system. These types of burns severely damage the skin and underlying structures such as nerves and muscles. They require additional shoreside treatment. Skin that has suffered a full-thickness burn appears leathery and stiff with no sensitivity to touch. If the burn is large, protect the tissue by covering the entire area with a clean sheet or cloth. This covering can be moistened with sterile saline or clean water to provide evaporative cooling. Monitor the victim's ABCs and administer oxygen if it's available. In the case of a chemical burn, immediately flush the affected area with large amounts of clean water. You may have to continue for 30 minutes or more to remove the burning agent. Use water. Don't try to neutralize the caustic substance with another chemical, or you may just cause more harm. Refer to your vessel's material safety data sheets for further instructions. If the victim has burned his eyes, irrigate them with eye wash, saline solution, or clean water. Start within seconds if possible, and continue for at least 10 minutes unless an unsafe condition arises. The faster you flush away the caustic substance, the less damage will occur. In the case of an electrical burn, protect yourself before you move to assist. Disable power supplies and eliminate the electricity source with extreme caution.
Buddy, wake up. Are you okay?
Be kind to yourself. If you've tried your best, you've done all you can, even if you haven't been perfect. Don't attempt to restrain a seizure victim or force anything into his mouth. If necessary, position him on his side so that his airway remains open as vomit or mucus drains away.
You want to come around here and grab his head for me?
Okay.
Just stabilize his neck until I check him out. Okay, let's just kind of roll him gently back onto his back. 1, 2, 3, go.
Make sure he has an open airway. After the convulsions have stopped, remove foreign matter or dentures from his mouth to keep him from choking.
Okay, I'm going to need a C-collar and some O2 here.
Take care not to make him gag.
Yeah, I'm going to put this over your head.
Supply oxygen if it's available. Reassure the victim. He'll be dazed and tired when he begins to awaken and probably won't remember what happened. He may be combative, but you've got to keep him quiet and monitor his condition until he regains full consciousness. Ask him if he is taking medication for the condition and convey his answer to the medical officer or consulting physician.
Oh no, I'm out.
John, what happened?
If a head injury victim loses consciousness, even for a moment,
Okay, we're gonna need
assume that he
Go wait
suffered a
down, get
concussion.
the rest of the deck crew and bring a spokes litter.
Keep him at rest until the medical officer is on the scene.
Frank. Take it easy. Try not to move.
Stabilize his cervical spine. He may have suffered a neck injury.
Is that a little better? Yeah. Okay, Frank, I'm going to shine a light in your eyes to check your pupils.
Check his eyes. The pupils should respond immediately to a light stimulus, and they should be able to track your fingers symmetrically in 4 directions.
Follow my finger, Frank.
If they don't track properly, he may have suffered a facial fracture or brain injury and must be treated with extreme caution. Look for blood or fluid loss from his nose and
I'm going
ears.
to look in your ears just to see if there's any fluid or any blood. Pinch his nostrils shut. We're going to try to stop the bleeding from his nose, okay? And while you're doing that, I'm going to clean out this wound on his head.
To treat a bloody nose, apply direct pressure to the soft tissue like this. If the bleeding won't stop or returns later, ask a physician for advice.
Again, Frank, but this may sting a little bit, okay? Just have to bear with me.
Dress facial lacerations using antibiotic ointment and sterile gauze or clean cloth.
Place.
Apply ice compresses to retard swelling.
Hold it in place. You don't need to put much pressure on it.
What's wrong, Tom?
Oh, I'm having heart pain.
If the victim is suffering chest pain but is conscious enough to talk to you, ask him what he's feeling and whether he has a heart condition.
Yeah, a little.
Heart pain is usually described as crushing or heavy. It can easily be confused with indigestion or an ulcer, so prepare for the worst. If he's having a heart attack, he may become nauseated and vomit.
Any history of heart disease?
Yeah, I have angina. That's why I've got those pills.
He may also be extremely pale, with sweaty, cool skin, and have difficulty breathing. Ask whether he has a prescription for nitroglycerin. If he has nitroglycerin tablets in his pocket, assist him in placing one of the tiny pills under his tongue. If his symptoms subside, keep him at rest until the medical officer arrives. Administer oxygen if you can. Check his blood pressure. If he feels no relief and his blood pressure is in the normal range, you may administer up to 2 more pills at 5-minute intervals. After that, put the medicine away and get help.
Okay.
Should help.
You think you lost consciousness?
After the immediate threats to the victim's life or limbs have been treated, look for additional injuries or medical problems.
A little tender.
Use your
Right
fingers
there in
to
the center.
gently palpate his body.
Okay. Anywhere else?
No, just in that there.
Okay, I'm going to put this collar back on now just to keep you still while I continue my...
You're looking for wounds, broken bones, swelling, and signs of internal or external bleeding.
Doing okay?
You're also looking for loss of function or sensation that may reveal problems with his musculoskeletal or nervous
Can
system.
you squeeze my hand? As hard as you can. Okay, good.
Tell him what you're doing and why. Ask him what he's feeling. Be careful about giving a seriously ill or injured person anything to eat or drink, especially if he's strapped to a backboard or flat on his back. If he vomits, his airway could become blocked, or secretions could be drawn into his lungs and hamper breathing. If he asks for food or water, make sure he's clearly able to swallow before giving it to him, and use moderation. For the same reason, don't give him medicine by mouth unless the medical officer or a doctor tells you to. Maintain sanitary conditions as you treat wounds. Irrigate or gently swab the affected area with clean water or sterile saline to remove foreign matter and decrease the risk of infection. Apply an antibiotic ointment to promote
you don't get any
healing
infection.
and help keep bandages from sticking to exposed tissues. Protect the area by applying a sterile dressing made from gauze or clean cloth. Use multiple absorbent layers. Injuries that are large or deep may require sutures or wound closure strips. Secure the dressing in place with tape or a bandage, but don't cut off the victim's circulation. Monitor the pulse and temperature of the extremity beyond the wound and loosen the bandage as necessary. If the victim has impaled himself with a knife or some other sharp object, don't pull it out. It may be acting as a cork, so that removing it could produce serious bleeding or internal damage. Pad and protect the area with clean materials.
Behind your leg here.
Comfort the victim and provide ABC's care until help arrives.
Yeah, that definitely tightened it up.
Good, good.
Treat suspected broken bones gently.
Okay, can you hold this around it?
Got it?
Check your leg here now. How about this leg? Is this
Ask the
sore?
victim if he can feel a broken
Not
bone.
sore? Okay.
Look for areas of pain, tenderness, swelling, or deformity.
Tell me when I get to it. That's real sore, huh?
Yeah.
Can you feel your foot?
If the broken bones have pierced the skin, control the bleeding, then clean and dress the wound. Use manual traction to stabilize the extremity until a splint can be applied. Immobilize the break using a prefabricated splint or rigid materials like a rolled magazine or cardboard box. Measure and otherwise prepare the device as thoroughly as possible before attempting to apply it to the injured limb. Apply ice or cold packs to the area to constrict blood vessels and minimize blood loss. Monitor the extremity beyond the fracture to ensure that your treatment efforts have not completely cut off circulation. Check skin color and temperature and the capillary refill rate. Loosen the dressing or the splint or both if necessary. Exposure to cold water quickly produces the condition known as hypothermia, or a serious drop in the body's core temperature. Prolonged exposure to cold air, wind, and spray produces the same condition. Symptoms of exposure to cold include pale, clammy skin, shivering, confusion or fatigue, and slow pulse and respiratory rates. When the core temperature drops to critical levels, the victim loses consciousness. The victim must be removed from the cold environment as quickly as possible.
Okay, gentlemen, let's lay him down gently. Be careful not to jostle him.
His heart and circulatory system may be at risk, so he should be handled gently, preferably on his back.
All right, buddy, we'll get you out of this.
Remove wet
Take your
clothing
shirt up.
and employ slow rewarming techniques, including the use of blankets or body-to-body contact. Don't try to rewarm him quickly by immersing him in a hot tub or shower. Don't position hot objects next to his skin. Don't massage his extremities or administer stimulants.
That's where you can. Relax.
Supply oxygen and keep him quiet until you have obtained medical supervision.
Yep, I need your arm.
Okay, this one?
Yep, just
Heat illness is best treated by prevention. Wear light clothing. Drink liquids frequently. Avoid alcohol and coffee, which are diuretics that contribute to increased fluid loss. Take frequent breaks and move into cooler areas out of direct sunlight. You may have to drink more than a gallon of water a day to keep up with the fluid losses incurred by working hard in the heat and to avoid the dehydration that can lead to heat fatigue, heat exhaustion, and eventually heat stroke. To treat heat fatigue or heat exhaustion, keep the victim at rest. Give him cool drinks and do whatever else you can to lower his temperature.
You might want to take a break, get some drink.
I'm fine.
The onset of heat stroke signals the complete failure of the body's temperature controls.
You all right? Man, I told you should get some water. Come on, let's get you in the galley. Hey, James, give me a hand here. We gotta get him in the galley. He's just like, he's burning up, man.
The victim will exhibit hot, dry skin, complete lack of sweating, severe confusion, and delirium. Move the victim to a cool environment.
Dave, I need your help.
Remove his clothing. Apply cold packs to his armpits, groin, and neck.
Armpit.
Promote rapid cooling by blowing air with a fan over cool water that has been applied to the victim's bare skin.
Dave, could you take some vital signs for me, please?
Monitor his vital signs carefully and continuously. Record the victim's temperature. An accurate temperature reading is best achieved with a rectal thermometer. Administer oxygen and IV fluids if they're available. Confer with a physician before immersing the victim in a cool or cold water bath. Complete immersion can be dangerous, and other methods should be attempted first. Poisoning or toxic emergencies are usually the result of contact with chemical liquids or vapors, or the ingestion of toxins or drugs. If you suspect that a toxic emergency has occurred, be careful to protect yourself. You could be incapacitated in seconds by the same hazard that affected the victim. For example, if a gas or vapor has caused the emergency, you can't assist until you're wearing a breathing apparatus or the space has been purged. When you can do so safely, move the victim away from the toxic hazard. Provide ABC's care as best you can, and try to gather as much information as possible about the type of poison or toxin in question and the method by which the victim contacted or ingested it. If the victim has ingested a toxin, don't administer fluids or attempt to induce vomiting until you've talked to the medical officer or a doctor and you're sure the victim is totally conscious. Consult the vessel's material safety data sheets as soon as possible. You should be aware of the presence of toxic or dangerous goods carried aboard your vessel and be familiar with warning labels, container styles, or placards that distinguish these hazards. Where known hazards exist, you should be familiar with techniques for avoiding contamination and providing resuscitation. If you know that an ill person is diabetic and he appears to be weak, irritable, or confused with no other obvious medical problems, consider giving him sugar in the form of a sweetened soft drink or juice. Before giving him anything to drink, however, make sure he is sufficiently conscious to hold the glass and swallow the liquid.
I'm going to ask you a couple questions. Don't move your head and neck around too much until I get done with these, okay? Do you remember what happened to you? Did you fall?
Until you are relieved, stay with the victim and continue to observe him carefully. Watch for vomiting and be prepared to keep the airway open. Monitor his consciousness. If he blacks out, check and recheck his ABCs.
Okay, great.
Recheck dressings or bandages. Keep him warm and quiet. Continue to provide reassurance.
Okay, all right. Well, look, I'm going to take this collar off and check your neck. Don't move your head yet, okay?
Hello, Dr. Ray Jarris. Yeah, Doc, we had a 51-year-old male. Looks like sudden cardiac arrest while he was out working on the deck pulling some line. We got to him pretty quick with the AED.
Brought him back with one shock.
The medical officer or consulting physician need to know how well the victim's body is functioning. They need a set of data referred to as his vital signs.
Yes, I'd like you to start him on 100.
First, measure his breathing rate.
Breathing a little bit.
He's got a pulse.
Most people inhale and exhale 12 to 20 times a minute, although a medical emergency can cause this rate to rise or fall dramatically. Simply observe or feel his chest or stomach and count how often it rises and falls in 60 seconds. It's easiest to count for 15 seconds and multiply by 4. Measure his pulse rate. The typical human heart beats 60 to 90 times per minute, creating blood pressure that moves blood and oxygen through the body to vital organs like the brain. Using 2 fingers, feel the victim's heartbeat at the large artery on either side of the neck and count the number of pulsations in 60 seconds. Don't use your thumb because it has its own pulse. Measure the victim's blood pressure. As soon as possible, take a blood pressure reading with the blood pressure cuff from the vessel's medical kit. If you get a reading lower than 90/60, the victim may be dehydrated or may have lost a lot of blood. Consider treating him for shock.
Put this under your tongue for 1 minute.
Take a temperature reading. Write down your findings and describe the treatments you've administered. Include the figures you've recorded for vital signs. Make note of any medications you've administered. Record the time of each event. The medical officer and the consulting physician need accurate data about the nature of the emergency and what you've done to treat the victim. Record additional sets of figures and observations each time you recheck his vital signs to provide a history of his condition. Carefully document the consulting physician's advice. Whenever possible, use personal protective equipment like gloves or a mouth shield. Blood-borne diseases are a constant hazard. Take care not to contact the victim's bodily fluids. Be equally careful to maintain sanitary conditions as you use medical supplies. Sterile surfaces must not be allowed to come into contact with contaminants. Dispose of medical wastes properly. Remove contaminated clothing and wash your hands. Your vessel's medical kit should be stocked with a variety of dressings, bandages, medications, and suture materials. Each crew member should be familiar with the contents of the kit and the uses of the items it contains.
Okay, here goes.
Medications can include both oral and injectable forms. Administering intravenous fluids can be life-saving if the crew has the necessary equipment and ability to start an intravenous line. A pharmaceutical guide is an essential component of the medical kit. However, it needs to be supplemented by access to a physician consulting service, such as maritime health services, so that medications are not administered inappropriately. The medical kit should be inventoried regularly to ensure that expired medications are discarded and that used materials have been replaced. Maintaining the kit should be the responsibility of the medical officer, who should be trained in gathering and relaying data to a physician, administering medication, and treating a variety of common conditions. Be kind to yourself. If you've tried your best, you've done all you can, even if you haven't been perfect.